We recording? Okay.
Come in.
Miss Sims?
Hi.
Hey, Miss Sims, how are you? I'm Tina. I'm going to be your nurse today, and I have to do an assessment for you.
Okay.
How are you doing?
I'm doing good.
Okay, we have a lot of questions and a lot we have to go through. So just bear with me here. Can you tell me a little bit why you came in?
Well, I was having a fever for about a week or so, and I was coughing a lot, and it was getting really irritating.
You were coughing up stuff?
Yes.
Okay. Do you take any medications at home?
No.
Do you have any past medical history?
Hypertension and high cholesterol.
Hypertension. You're young. Okay. Does your family have any past medical history?
Yeah.
Okay. Same thing.
Yeah.
Do you smoke?
No.
Do you drink alcohol?
Well, socially.
Socially. Do you use any other drugs?
No.
Okay. And have you had any vaccines, or are you current on vaccines?
I had my tetanus and my meningitis.
Okay. Is that all you can remember?
Yeah.
Okay. Maybe a few more here and there?
Yeah.
Okay. Well, it looks like the doctor has diagnosed you with pneumonia, so you're going to be admitted to the hospital getting some IV antibiotics.
Okay.
Okay. So we're going to start. Right now, I would just look at my patient. This is with the general survey. Obviously, she is speaking well. She has good nutritional status. She seems pretty alert and oriented. We'll go through that in a little bit. At this point, I'm going to get your vital signs, okay?
Okay.
Make sure that the room is private. No one can see what's going on. We have the door shut. And I'm going to just wash my hands and do everything beforehand, okay?
Okay.
Okay, so I've washed my hands. Can you tell me how much you weigh? Or I can just use the bed scale.
Okay. I haven't weighed myself in a while.
Perfect. Says you are 147.
Works for me.
I'm just going to write this down as I go. Do you know how tall you are?
I think I'm 5'8".
You think you're 5'8"? Okay.
Sounds about right.
Just going to get your vital signs here. So your blood pressure runs a little bit high sometimes.
Sometimes.
I'm going to stick this on your finger.
I think it's my job that does it to me.
Stressful, huh? And just rest that arm down. Put this under your tongue for me. And while I'm doing this, I'm also looking at her mood. I'm looking to make sure she's got proper hygiene. I don't see any obvious clubbing in her hands or fingers, more so. We're just waiting for your blood pressure to get done, okay? Your breathing looks good too. Perfect. I'm just going to write all this down. It's running a little bit high, that bottom number.
Could have told you that.
But everything else looks good. You're not running a fever anymore. Get you all unhooked here. Perfect. Just off to the side. All right. You ready to start?
Yep.
Okay. So we're just going to do head to toe here. Just going to put this down. I'll be by your side. So the first thing I'm going to do, start at your head. I would just look. I can see your hair looks healthy. It's even. I would look at the scalp, make sure there's no lesions, everything is intact, and make sure when I palpate, no tenderness or anything, correct?
Mm-hmm.
Good. Then we're going to move to the face. I'm just going to palpate for the temporal artery. And if any time during the assessment you have any discomfort or pain, just let me know. I'm looking to make sure that the pulses are equal and strong on both sides, which they are. And then we're going to move to the face. I'm going to first look at the skin, again, make sure there's no lesions, make sure that everything is intact. Can you smile for me? Do you have any numbness or anything going on in your face?
No.
Full sensation on both sides?
Yes.
Perfect. This is what I'm looking at, cranial nerve number 5. And then we could palpate the sinuses. So we go right above here, and we go right here. And this doesn't hurt at all when I do that.
Correct.
Good. All right, let me grab all my stuff that I've gathered. So we're going to start moving along here. Okay, we're going to look at your eyes. Now we have the Snellen chart perfectly distanced between this and the bed. So what I want you to do is cover one eye and read me those letters from left to right.
D-E-F-P-O-T-E-C.
Do the same thing with the other eye.
D-E-F-P-O-T-E-C.
Good. 20/20 vision there, huh?
Yep.
Okay. Alrighty, so what do I want you to do is first I'm just going to inspect the eyes. Again, looking at symmetry when you blink, that you blink involuntarily. And then we're going to look at the sclera. They're nice and white. We're going to look at the cornea. And the irises, your cornea is transparent and clear. Your pupils are both round. They look equal. I'm just going to shine a light in there. I'm going to ask you to close your eyes. And when you open, you're going to see a bright light. And what I'm looking for, go ahead and open. One more time. And open. I'm looking for your pupils to constrict when I introduce light, which they do. Next thing we're going to do is we're going to do a combination test. So I want you to look at my finger and then look up at the clock there. And again at my finger. Good. And what I'm looking for is your pupils to constrict when you focus on something near and dilate when you focus on something farther away. All right, and then we have my ophthalmoscope here.
It's weird because you can actually feel your eyes changing.
Okay, just going to turn this on, and I just want you to look straight ahead, okay? And I'm looking for the red reflex. Good. Which is present in both eyes. Put this off to the side. Okay, moving on, we're going to do we'll do your ears. So what we would do is make sure, look at the skin, make sure everything's intact, no redness. I would feel the pinna, make sure any tenderness when I do this. Okay, and the tragus. Any tenderness?
Yep.
Good. We're making sure that both of them are symmetrical. And then we're going to get the otoscope here. And what you do when you look at the ears, you want to pull the pinna back and up to look at the internal canal. And I'm looking to inspect the canal, make sure there's no lesions. A little bit earwax is normal, a tannish brown color. And you're looking at the tympanic membrane, which should be a pearly grayish color.
Do I have earwax? My bad.
We're going to do the same thing on this side. Up and back. And ear looks good inside, and your eardrum, which is the tympanic membrane, is a grayish color. Perfect. Okay. Ears are good. Now we're going to move to the nose. I'm going to look at your septum. Make sure it's midline. Make sure it's not deviated off to one side. I'm going to ask you to breathe through and breathe through here. Air moving freely on both sides. Do you feel it any more than the other? Okay. Good. Now we're going to do your sense of smell. So I want you to go ahead and close your eyes for me, and I'm going to introduce a scent to you. If you could just tell me what you smell.
Coffee.
Coffee? Good. You got it right. You can open your eyes. Your nose is symmetrical. Everything looks good there. We'll move on to your mouth. So when you smile, go ahead and smile again. Everything looks good, symmetrical. First thing I would do is inspect the mouth. Your lips look fine, not cracked, any lesions. Go ahead and open. She has all her teeth, nothing missing. Stick out your tongue for me. Tongue has no lesions, skin is intact. It is midline and symmetrical on both sides. Okay. And I ask you to stick out your tongue while I take a peek more farther in. And I'm looking at your uvula, and I want you to say ah. Good, and I'm looking for the soft palate and the uvula to move up, and I'm just inspecting the mouth a little bit more. Can you move your tongue up and down? Like, and then side to side. I'm just making sure that the tongue can move in all directions. Good. Let's throw this away. Now we're going to do taste, okay? So what I want you to do is close your eyes again. And just kind of give me a description of what you're tasting.
Sour.
Sour, good. Lemon juice. And we're going to do one more. Stick out your tongue. How's that?
Sweet.
Good. That would be sugar.
Make some lemonade.
Good. So everything on the face looks good there. Then what would I do is I'm going to palpate any of the lymph nodes starting from the back here. What you're looking for is not to feel any swelling of the lymph nodes when they come up, because your lymph nodes can get swollen. No discomfort when I do this?
Mm-mm.
Okay. Good. Now we're going to test your hearing. I'm going to have a tuning fork here. What I'm going to do is I'm going to activate the tuning fork and put it on top of your head, and I want you to tell me what ears you can hear it in.
Both.
Good. We're going to do this again. I'm going to hold it against the mastoid process and just tell me if you can hear it and when you stop hearing it.
I can hear it.
And when you stop.
Stop.
Good. Get on this side.
Hear it.
And when does it stop?
Stop.
We're going to do it again. Can you hear it?
Mm-hmm.
And when does it stop?
Stop.
Good. And again. You can hear it?
Yeah.
And when does it stop?
Stop.
Good. So that was the hearing test. I believe you do not have any hearing loss, which is good. Okay. Now since you're coughing, I'm going to assume that you do have a gag reflex. We're going to move back to the mouth for a second. We're just going to test that real quick, okay? Okay. Good. And that is present. No problem swallowing?
No.
Okay. Go ahead and swallow for me. Hyperextend your neck and swallow. What I'm looking at is your thyroid gland, which is not something that we can see, but I'm looking, it's normal for us not to see it. Same thing with feeling it. It's not something we see, but again, this is where I would palpate the trachea, make sure it's midline and symmetrical. Can you move your neck up and down from side to side? No problems. Can you shrug your shoulders? Good. Okay. Can you open and close your mouth for me? Okay. Any discomfort?
No.
I'm looking for a clicking sound, but there is no. You don't want a clicking sound. It moves smoothly, which is good. Okay, I'm going to Feel your carotid arteries. And at this point, I'd be looking for any jugular vein distension or pulsations in the neck. Good and equal on both sides with the carotids. I'm going to listen to them. And you don't want to be able to hear these pulsations. Good. We could also assess for any signs of meningitis. So what we could do is lay you back some, going down. Okay. And you want to bring your face into where your chin is touching your chest. And I'm looking to see if any movement goes on in the lower extremities or if you feel any discomfort. Okay. Good.
What does that do?
Assessing for meningitis. Not that you've had any signs, but if we see any movement, then it could be a positive sign. Okay? We're going to move on to the chest. First thing you want to do is inspect the chest. Make sure the skin's intact. There's no lesions. You want to use the diaphragm of the stethoscope for the lung sounds because the diaphragm is for the higher frequencies. The bell is for the lower frequencies for the heart. I want you to say 1, 2, 3.
1, 2, 3.
Good. And I'm looking to feel a vibration when I do that. So we're going to just listen. I want you to take big deep breaths for me. In and out. Good. Again. Good. So we're going to do anterior, posterior, and lateral. Good. Moving to the lateral side. Big deep breath in. Again. And again. Good. We're going to move to this side. Big deep breath in. Good. And again. And one more time. And while I'm doing this, I'm also going to do your heart. Always do up here, and then I'm going to do your apical, which I would time for a whole minute. Good. Your apical is going to be down here. And then what I'm going to ask you to do after this is we're going to sit you up and listen to the back, okay? Good. Saying that a minute went by there. One more thing. We can percuss over the lungs in each of the fields. Okay.
What does that do?
We're listening for a renaissance sound. Okay, sit up. And I would inspect the back again. I could palpate the spinal processes of the vertebrae while I'm doing this. After inspection, we're going to listen. Big deep breaths. Good. Again. Keep going. Again. 2 more times. Good. Your lungs sound pretty good. Alright, go ahead and lay back down for me. Now we're going to move to your arms. So what I want you to do is put your arms out, and I want you to push against my arms down. Testing your strength. Good. And squeeze my fingers. Making sure your strength is age appropriate. You can put your arms down. And that your strength is equal on both sides. We can palpate the epitrochlear nodes right above the elbow Again, you don't want to be able to feel these lymph nodes. Good. Test for the radial pulse. Strong and equal on both sides is what we're looking for. And you could also do capillary refill, which you want to be less than 3 seconds. Good. We can also do the reflexes in the arm, which we can do. Let me sit you up a little bit higher. And I'm just going to kind of hold your arm out and kind of use my stethoscope. Just kind of bend your arm a little bit. And we're going to do the bicep. Good. And the tricep. And you're making sure that there is reaction and it's equal on both sides. If we were doing a breast exam, we would do this probably at this point because we'd be in the chest area. We're not going to do it, I'm just going to talk about it. So when you do the breast exam, first thing you want to do is inspect, make sure it's symmetrical. You want to look for any dimpling. You want to make sure the areola and the nipples look the same on both sides. There's no cracking, discharge, or no tenderness. You want to do a self-breast examination, or when you get it done, you put your arm above like so. We would palpate up here and in the axillary area. And when we do that, we're looking for any dimpling. And then with the actual breast exam, I would go in a circular motion. Okay. Same thing with the men. We would inspect both of them, make sure they're symmetrical, do the nipples and areola, and palpate. Obviously more common in women to have the self-breast examination done. Now we're going to move on to your abdomen. So we're going to go back down again. I'm just going to have to pull your gun up to see your stomach. First thing I want to do is inspect the stomach. And I'm looking to make sure that there's no lesions, the skin's intact. The patient is not overweight, not distended, or anything like that. It'll come back for you.
Got them both on.
Okay. Good. So everything looks
Cool.
Everything looks good. Has your appetite been okay?
Yes.
And you last bowel movement when?
See, this morning.
Good. I'm just going to listen in all 4 quadrants. And I'm listening for just bowel sounds, little gurgles, which are quite active. Next I would palpate. Any tenderness?
No.
Okay. You want the abdomen to be soft, non-tender. Okay. We could also percuss, again using the same technique with the lungs, over all 4 quadrants. You could also, on the left side, try to feel for the spleen, right? But the spleen is not usually palpable. Okay, and again, this is where we would do the femoral artery, which you want to do on both sides, make sure it's present, strong, and equal. And we would palpate the inguinal nodes and make sure they're not swollen. At this point, I would probably move on to the lower extremities before doing any perineal exam, since that is the most invasive. So we will go into the lower extremities. So I'm going to pull this blanket down. First thing I would do is look over your legs. Make sure everything looks good, no lesions, skin's intact. I'm going to feel for your pulses behind your knee. Strong and equal. The tibial and your dorsal pedialis, which is strong and equal. Good. I'm going to ask you to push against my hand, testing your strength. Good. And can you move your legs up and down, circular, testing range of motion of the hip? Good. Same thing there. Good. Move your feet like so. Okay. So it looks like you have pretty good range of motion. We could also assess for DVT. which we would dorsiflex the foot. Do you have any calf pain? Good. Any calf pain?
Nope.
Good. Can you feel me touching both?
Yeah.
And it's equal on both sides?
Yeah.
Good. I would do the capillary refill in both of the feet, make sure it's less than 3. I would inspect between all the toes, make sure there's no lesions where it could be. We could do a Babinski reflex, and we would go against the foot. Sorry if it's tickled. And I'm looking to make sure that her feet don't fan out, because that would be a positive sign. Okay. Can you take your one foot and take it up to the knee of the other leg and go down? Slide it down.
Oh.
Good. Do the same thing with that one. Good. And close your eyes for me. What direction am I pulling your toe?
This one.
And this one? Good. And put your head up. Now we're going to do sensation and a few other tests. We're almost done. Okay. Close your eyes for me. And tell me if what you're feeling is sharp or dull.
Sharp. Dull.
Good.
Tickled. Sharp. Sharp. Dull.
Good. We would also do, let me put your bed down a little bit more. I want you to take a finger and touch my finger and touch your nose. Again and again. And do the same thing with the other hand. Good. I want you to sit up for me on the side of the bed. And I kind of want you to go like this with your hands in a rapid motion. Good. And I want you to go like this, like 3 times. No problem. Okay. Close your eyes and tell me what number I'm drawing in your hand. 8. Perfect. You can put your hand down. Okay. I want you to stand up for me. And I want you to try and bend over and touch your toes. Good. Testing your range of motion, I want you to go sideways and sideways. Good. Can you stand on one foot? Can you stand on the other foot? Can you hop on one foot? Can you hop on the other foot? Okay, good. Can you walk just like normal? Here and back? Good. I'm checking her balance, make sure nothing's going on there. Can you walk on just your heels? Good. And can you walk on just your toes? Good. No problem.
And that was visual.
And I would make sure I document all this when I was done. Get this out of the way. And I would help the patient get dressed, ask her if she needs anything else.
No.
You okay? I would then take my gloves off, wash my hands, make sure the bed's in the lowest position, call bells with the patient, everything safety-wise is okay, and be done with everything. Okay.